nice opportunity to be before the reception. So today we are going to speak about elder abuse, and I have some very specific objectives for us. And we're going to be crossing over the line between talking about elder abuse as it occurs in domestic settings and elder abuse as it occurs in long-term care. When we look at the National Research Council and the National Council for Elder Abuse, we sort of divide up our discussions of elder abuse, and our research focuses on where elder abuse occurs. But because you guys are such a wonderfully eclectic group of individuals, I want to make sure that we're hitting both sides of the fence there when we're discussing this, as far as domestic abuse that occurs in the community, which we call domestic elder abuse, versus institutionalized or long-term care, so abuse that happens in the long-term care setting. Because I would guess that most of you in your clinical practices see individuals from both settings. In the emergency department where I used to work, we had folks brought into us from long-term care, but we also interfaced with elderly folks coming in from their home, and they lived in the community. So it's important for you guys as a group to have an understanding about this, as both of those types of elders come from those different types of settings. So we're going to look at defining elder abuse and what it is and where those definitions come from. We'll also look at some of the different types of elder abuse and talk about some of the signs and symptoms. We'll also look at some of the characteristics of individuals who you need to keep an eye open for, who are more likely to be abused, as well as potential perpetrators. I actually, because of my background, tend to study elder abuse from a criminality approach. I'm not as interested in some of the theoretical approaches about why people do things, as much as I'm interested in routine activity theories which come from criminology that basically prevent criminals from being able to perpetrate criminal acts. Elder abuse is a crime. It's a crime in the state of Colorado, one such that will actually get you additional mandatory time if you are convicted of elder abuse. So we'll talk about potential perpetrators and try to look at what some of the characteristics are of people who may be harming our elders in the community and in long-term care settings. And we'll also look at the role that you guys as registered nurses play in preventing elder abuse and potentially recognizing it when it is occurring. And we'll look at some of the changes ethically and legal mandates that have occurred recently here in the state of Colorado that are new that you need to be aware of that can impact your practice. So first and foremost, it's important to recognize that we are aging as a population in the United States. If you don't die, what happens is you age, right? You get older. And so about over 40 million adults in the United States are over the age of 65. 21% of that group of people are minority. So this is a wonderfully aging, large group of individuals. They're also a very diverse group of individuals from racial and ethnicity perspectives. And we're also a lot wealthier as a group of individuals than people over the age of 65 have been in the United States. So where we still have a substantial number of individuals over the age of 65 below the poverty line, most of our older adults are doing quite well financially, and we'll see how this impacts some of the different types of crimes that we're seeing being perpetrated against elders. One of the biggest growing areas is financial exploitation and abuse. So much so that many counties, including Boulder County, in their district attorney's office actually have a specialized crime unit dedicated to doing nothing but investigating and prosecuting financial abuse of elders. That's how big this issue is. So we know we have this wonderfully growing population of older adults that's very diverse. Many of them continue to work past the age of 65, right? We all know that. And many of them also have different types of living arrangements than we had seen maybe in the past. Majority of our older folks in the United States still live independently. But due to recent economic downturns, we've certainly seen individuals moving in with family members, right? So not only are you seeing older adults move in with their children, but you're seeing children move in with their older adults. Many older adults are also caring for their grandchildren or raising their grandchildren. And as we talk about some of the changes in living situations of our older adults, that changes the potential risks for abuse that our older adults may experience in our communities. So hopping over to the long-term care institutionalized group of individuals who only really represent about 5% of the older adults in the United States. So about 5% of our folks in the US are institutionalized. So most of our folks live in the community. But for those who live in institutionalized settings, we have some top complaints that our governmental agencies keep track of. So I always try to drive our statistics home to what's relevant to us here in Colorado. And the top 5 complaints that we are looking at in Colorado include quality of care. So when we look at what has been reported to ombudsman's programs here in Colorado, about 1,300 complaints were made in 2009, which is the most recent ombudsman report that I can access. About 1,300 of those were related to quality of care. About 1,200 of the complaints that were received by the ombudsman's programs were related to quality of life issues. And we'll talk about what some of the quality of care versus quality of life issues are. Quality of life usually includes autonomy and choice. So there were complaints made about older adults not having autonomy or choice. Also, the next complaint related to the systems, benefits, or other agencies, so about 600 complaints related to that. 400 complaints, a little over 400 complaints were related to the environment of long-term care itself. And about 415 complaints were related to admissions, discharges, and evictions from long-term care environments placed by residents. What is unique about the quality of life category when it comes to complaints within long-term care is that this is the category of complaints that includes abuse and neglect. So within those 1,300 complaints related to abuse and neglect, about 300, just short of 300 complaints in 2009 were related to complaints of abuse and neglect within long-term care in the state of Colorado. 500 complaints of those 1,300 were related to lack of dignity in care and services. And 1,300 complaints were related to violations of civil and or religious rights not being honored for the people that were institutionalized. And I'm going to attempt to take us here to this YouTube, and we'll see if I can do this in a way that works for us. Kind of depends on if we can get us internet. There we go. It takes a little bit of time. We can see it, but you can't. We're having a great time here. I always run this risk when I do this. Really, this is an instance, and we'll see if we can get it pulled up here for you, but if you're ever looking for an absolutely heinous thing to do on a Saturday afternoon, if you don't have anything else to do, Google elder abuse on YouTube and see the variety of news coverage that comes up related to current cases of elder abuse, especially as it relates to news stories across the United States. You may remember that just recently here in the state of Colorado, in Broomfield, I believe, we had an individual who was charged with sexual assault of 2 individuals in the long-term care setting in which he was a nurse's aide. And unfortunately, the second news story that came up about this was related to the fact that even after he had been charged, his administrators felt it okay for him to come back to work and still take care of individuals in the long-term care setting. So here within Colorado, we've had some very recent issues with sexual assault in long-term care. This particular instance, if you pull this up in your PowerPoints when you go home, is related to a case that happened in Oklahoma. And very often, instances of elder abuse are discovered by families inadvertently discovering what's going on inside of their parents' or loved ones' long-term care facility. It's okay, because they've captured it on tape. In this particular instance in Oklahoma, if you pull the story up, the family was very concerned that their mother was having things stolen from her out of her room in the nursing home. And so they put a hidden camera in her room in the long-term care facility, and come to find out, what they discovered was not instances of stealing, but they actually caught some very significant moments where the caregivers in the long-term care facility were caught on tape trying to cram care gloves, nitrile gloves, into the mouth of their 93-year-old mother. And so during this care episode, you see the individual taking a handful of plastic gloves and trying to cram them into the mouth of this elderly woman. You also see her walk behind her and slap her on the back of the head. You also see her with another CNA try to put this elderly woman, frail elderly woman, into the bed and pretty much yanked her up, threw her down, and then pushed her by the forehead back onto her pillow. And all of this was captured on tape inadvertently because they thought somebody was stealing from their mother. There's quite a few other instances. One of the more heinous ones that's available for you on YouTube, if you'd like to pull it up, is two individuals who were caught in a home health circumstance where you had a male home health aide who was delivering care to an elderly woman in her home, and another male home health aide joined him in on this shift, and you actually see one of them take their penis out. They proceeded to have sexual touching amongst themselves, and then rub their penises on the elderly woman who was incapacitated in the bed that they were caring for. And so they were inadvertently caught on tape sexually abusing and assaulting this individual in her home. And those were individuals who were vetted by a home health agency and allowed to care for vulnerable adults. So let's talk about some of the types. Let's go back to some definitions. So now that I've completely horrified you and that I have your sole attention, this is why people need wine when I'm done. So it's very important for you to know who provides the definition of elder abuse, and it really varies. The important things for you to walk away from this are, we have some big global definitions of elder abuse that come from the World Health Organization. And to prevent you from having to take notes and frantically scramble to write things down, I've just stuck it up there for you. Yes, I've violated every law possible about good PowerPoints on this, okay, so that you don't have to write. The thing that I really want you to pay attention to is this issue of single or repeated act or lack of appropriate action. So elder abuse is not only what we do, it can be what we don't do. It's acts of commission as well as omission, and it occurs within a relationship of trust. So when we're talking about elder abuse, the important thing for you to keep in mind here is this does not include stranger crime. Okay, when we talk about elder abuse occurring in a domestic setting or an institutional setting, we're talking about where there is an expectation of trust between the elder and whoever that other adult person is. Okay? It can include various forms, and we're going to talk about each one of those forms. And the CDC also provides us a definition. Now, what's different between the CDC and the World Health Organization is that the CDC, to try to help a sister out, gives us an age frame to at least pay attention to. And CDC defines elder abuse as something that occurs after 60 or older. And that's simply because the Older Americans Act, which was enacted in the 1970s, allows you to receive services as an older adult at the age of 60. But many of us would argue that at the age of 60, we are not very elderly. right? My mom does not get a big thrill out of the fact that she qualifies for elder abuse by being over the age of 60. So, but what you'll see here is similar, again, is this expectation of trust. Okay, and that occurs across the definitions of elder abuse that we talk about. So those are very important things to remember. The other important thing for you to keep in mind is that the legal or criminal statute which defines elder abuse varies by state. Okay, and if you do a Google search for your facility, wherever you work, you can pull up the Colorado Revised Statutes. It's under Article 26, and that provides the definition of criminal elder abuse for the state of Colorado. So it defines it for you as well. But these are the big definitions that we use when it comes to research. Okay, so how big of a problem do we have here in the United States? Well, a fabulous gentleman named Dr. Ron Acherno, who works out of the VA and Medical University of South Carolina in Charleston, did the most recent national prevalence study. And he and his team randomly dialed 5,777 older adults across the United States and asked them in the last 12 months if they had experienced various forms of abuse. And so they described these forms of abuse, and they tried to get the people who consented to participate in this study to tell them if they had personally experienced any of those forms of abuse in the last 12 months. 11.4% of those 5,777 individuals admitted to experiencing one or more types of abuse within the last 12 months. So that included 0.6% who had experienced sexual abuse in the last 12 months, 15% that had experienced financial or exploitation, material exploitation. It included about 5% who admitted to being physically abused, and about 10% who admitted to being emotionally or psychologically abused, and another 5% who admitted to being neglected in the last 12 months. And these are the people that we could get to randomly agree to talk to somebody on a blind Tuesday across the United States. So just like all forms of violence research, we believe that this 11.4% prevalence rate of elder abuse probably just represents the tip of the iceberg. Because elders, just very much like any victim of violence or crime, have a hard time admitting that this has happened to them. Yeah, that's right. And this is one of the biggest things that we run up against as nurses and as researchers, is this issue that for the elders themselves who are experiencing elder abuse, they're often very ashamed, they're very embarrassed that this is happening to them, or that they feel they let this happen to them. And so therefore they're very reluctant to tell us about it and to give us the details, especially on who's harming them, because as we'll talk about, the #1 perpetrators of abuse against elders are their adult children. And that's for all forms of abuse, including sexual abuse. So it's very hard for older adults to admit that this is happening to them. And we always have to keep that in mind when we're talking with them. As far as the long-term care side of the community, we have no idea. It's like the Wild West. We don't know what the prevalence rate is out there. But what we do know in testimony to the Senate committee in 2002, and we haven't made a lot of progress in the years since in determining prevalence, is that it's serious, widespread, and largely hidden. So as you can imagine, within any organization in long-term care, there is an incentive, right, for us not to pay attention to this. There is an incentive for organizations based on mere fact of survival to not report instances of abuse, or to somehow make sure that nobody knows about this, because that reflects badly on them. So we have no idea, although what I can tell you is there's a group of researchers, particularly one, who's made her entire career out of studying nothing but sexual abuse in long-term care. Now, if you can make a career out of it, that tells you that we have some significant problems. We know we've dealt with everything from pornography rings, prostitution rings, all of those being perpetrated against older adults in long-term care settings. And boy, you think you're going to need a drink when I'm done. When you hear Hollie Ramsey speak about sexual abuse in long-term care, pretty much people just want to walk out and just bury themselves and never come out to see the public again. Okay, so let's talk about the types of abuse. These are the main categories of abuse. Depending on what definition definition of abuse you're looking at, you'll see abandonment may be added to this list, and self-neglect may be added to this list. Self-neglect is an entirely different area of statistics and an entirely different area of research. So none of what we're talking about here includes cognitively able individuals deciding not to take care of themselves. Okay? Okay, physical abuse. Physical abuse is hitting, slapping, punching, burning, restraining, or basically doing anything that results in physical damage to an older adult. And some of the signs that you may see would be broken bones, internal bleeding, fractures, burn welts, lacerations, any of those forensic markers that can tell you that somebody has harmed that person physically. And keep in mind, an older adult's reporting that somebody has physically abused them. Sexual abuse. Sexual abuse is defined as any unwanted touching, either directly or indirectly, of the breast, anus, groin, genitalia, mouth, or anus. And it can be identified by any of the usual sexual assault symptoms that we see in younger populations. So STD contraction, so if you have an older adult that is suddenly coming to see you because they've got something going on where they're having STD symptoms, that could be a sign that they've been sexually abused, just like we see with children. Also, any bloody stained clothing, bruising in any of those physical areas that I've mentioned, or an older adult's report that they have been sexually abused. Neglect. Neglect is basically defined as failure to provide for the basic necessities of life for an older adult, so food, clothing, shelter, and access to health care and medications. Some of the symptoms that we see include older adults being over or under-medicated by lab values. So when we draw labs on folks and you find out that they're either way over their blood levels on some things or they're not meeting therapeutic levels on something at all, you need to keep in mind this could be more than just somebody not managing their medications. This could be somebody that's actually being neglected or chemically restrained in some cases. Okay, over or under medicating, dehydration, poor personal hygiene, malnourishment. And I think as nurses, these are these things that you see this and you go, wow, that makes sense to me. This person doesn't look like they're being cared for. They're not dressed appropriately for the weather. They aren't being bathed. They're developing wounds that aren't being cared for. We're really good as nurses about identifying neglect. We're not so great at identifying some of these other areas. Financial exploitation. When I talk to nurses in the long-term care setting, this is the one that they have probably the most experience with that really bothers them. When we see abuses of powers of attorney, we see individuals using that older adult's wealth or resources for their own personal benefits. Certainly we have instances in this state and in this community, if you go over to the Boulder DA's office, they'll be happy to tell you about it, where individuals have scammed older adults out of large quantities of money, either through real estate investments or whatever type of thing that they can talk the older adults into. One of the things that's very interesting that you may not know about when it comes to financial and material exploitation in particular is that in Denver, we have elder abuse investigators who do nothing but follow gypsies. We have an organized crime ring that comes through Denver and particularly targets older adults. And these are actually Romanians, so I can use the term gypsies. They're actually a group of organized crime individuals from Romania, and they target older adults. And one of the things that they do that Denver, the city of Denver and their district attorneys are aware of is the fact that they will worm their way into an older adult's life. So they may stand outside of the King Supers, wait for their mark, right? So they wait for an older gentleman coming out doing his shopping. They may walk up to that person and say, hey, oh, it's so wonderful to see you. How's she doing? I haven't seen you in such a long time. What do you think the older adult does? Yeah, they're not quite sure, maybe they've had some memory problems, but they end up getting sucked into believing that they've had some sort of personal relationship or interaction with this person through another person in their life. And then the next thing you know, and it's usually a young woman, this young woman says, well, let me help you, let me help you take these groceries home. And then they get to that person's house. Wow, how about I just pick up around here a little bit for you? And then the next thing you know, they're not leaving the house. Well, I'll just stay because you need me to help you. I'll just cook for you, I'll do your housekeeping, I'll do your shopping. And so this person has wormed their way into this person's domestic life. Then the next thing you know, the other portion of the crime ring, and this is how this operates, is the male side of the crime ring starts coming to the house and trying to sell services. And these services usually involve roof repair, deck repair, painting, other types of services that older adults may not be able to provide for themselves well anymore. And they get the money up front, they don't do the work. Then the next thing you know, the younger female version has talked the older adult into changing wills, to putting her name on bank accounts. And we actually have a ring of individuals that we track that does nothing but this. And Denver follows them very closely as they go across, as they come across the United States. We're one of their hits. Denver is, and the older adults in our community. I'll get you right after this. Okay. So it's important for you to keep that in mind. Emotional and psychological abuse, as it relates to elder abuse, can be defined as anything that causes embarrassment, humiliation, or emotional or psychological trauma to an older adult. This includes limiting access to support systems. This includes embarrassing or humiliating individuals or infantilizing older adults. Do any of you have you ever watched anybody baby talk to an older adult? Yep. Yeah, well guess what? That's emotional or psychological abuse, and it's called infantilizing. So unless you're somebody that in your care plan has really let your preference for being infantilized be known, when somebody baby talk to an older adult, that can be considered abusive. And that's something that when I talk with people in the long-term care settings, their CNAs and other folks, we've got a big problem with. People don't realize, and there's some cultural issues there, I think, too, but emotional and psychological abuse, a large percentage of the individuals, about 10% of the folks that Dr. Acherno randomly dialed, admitted to having been emotionally or psychologically abused in the previous 12 months. And unfortunately, this is asterisk because I cannot tell you what the Colorado Adult Protective Services statistics are on this because we don't keep any. There were no instances where emotional or psychological abuse was investigated in 2009 by APS. So we don't know. In doing my research with individuals in the community, I can tell you it's quite substantial.
Could I say something before we move on, please?
Sure.
Thank you. I think we need to be cautious about singling out a particular ethnic group for who might be most likely to conduct abuse of any group of people. Gypsies are it's an ethnic group, and I'm sure that what you're saying is true, that this has happened, but I'm very uncomfortable with that whole route that you went down there. I'm really, really uncomfortable with that.
Okay, and I appreciate that. That term was used by the Denver City District Attorney's Office, and specifically their elder abuse investigator. So that's really his term more than my term, but I appreciate your concern. Thank you. All right, so let's talk a little bit about bruising. Any of you who may work in long-term care, or if you see older adults coming into your ambulatory settings, we get really concerned when we see bruising. That's one of those indicators that we need to look at and consider as it relates to physical abuse. Wigglesworth and her team were actually contracted and received money from the National Institutes of Justice to do a forensic study specifically on bruising. And because we are nurses and because we look at bruising and we do a lot of documentation to bruising, I wanted to bring this particular research to your attention, and it's also included in your reference list if you want to go and find this article for yourself. Here's what we know about bruising as it relates to elder abuse. Physiologically, right, we know that older adults are more likely to bruise. We have thinner skin, less subcutaneous fat. We bleed easier. Older adults bleed really easily. And this is always concern. What we've learned through this study is the fact that older adults, when we took an abused cohort, so there was an a group of older adults with confirmed abuse, and we compared them to a non-abused cohort of older adults. And what we learned is individuals who experienced abuse were more likely to be bruised in the following areas: head, neck, posterior torso, and right lateral arm. And that the bruises of the abused group were much bigger than the bruises that occurred from just randomly bumping into things and stuff like that. So 5 centimeters or bigger, and occurring in head, neck, posterior torso, and right lateral arm. And when we compare what we know forensically about child abuse, all of those locations are consistent. Okay, so this is very consistent to what we've learned about child abuse over the years, and the fact that the only difference between the bruising patterns of children experiencing abuse and older adults experiencing abuse was the right lateral arm. Why do you think we have right lateral arm bruising? Right. Yeah, it's a defensive move. And we don't see that in children as much. You don't see as many defensive moves when you're looking forensically at bruising in children in cases of abuse. So if you're concerned about bruising, you've got people coming into whatever setting you work at, and you're taking a look at that, keep those things in mind. The other thing that was really important from this study is they included in their abused and non-abused group individuals with mild to moderate dementia. And the individuals with mild to moderate dementia were able to accurately tell the story of what caused the bruising. So we need to pay attention to the location, head, neck, posterior torso, and right lateral arm, the size, 5 centimeters or greater, and the fact that even individuals with mild to moderate dementia were able to accurately describe the situation that resulted in the bruising. I don't know about you, but I would bet that if I took a baseball bat and came at you with it, you might remember that. The same is true for people with mild to moderate dementia. So this was a very significant study. We can't just blow off and not take seriously what an older adult tells us, even if they have mild to moderate dementia. They still could be accurately describing what had happened to them. And that's important. Okay, so who's likely to be at risk for being abused? Well, it may make a lot of sense to you that it's our more cognitively and functionally impaired individuals. So the more cognitively and functionally impaired you are, the more likely you are to be abused. The poster child for abuse, elder abuse in the United States, is a 77-year-old white female who lives alone. Okay, if we took everything that we know about it, whittle it down, that's the poster child for elder abuse in the United States. So cognitive, physical, decreased functional ability, depression, dependency on others for food or for care, because that invites people into your life, right, who may not have the best intentions. Dependency on others for management of their finances. History of family violence still shows up there. There's a lot of skepticism now as we continue to do more research about this intergenerational transmission of violence. We have less and less to support the fact that if you abused your child, that child may grow up to abuse you as an elder. Okay, that whole theory is called intergenerational transmission of violence. And we're having less and less support for that as we do studies. So we certainly have instances, and a lot of instances, where an adult may have abused a child, but when that adult becomes elderly, the child does not abuse the elder. Okay, so intergenerational transmission of violence, you got to be a little skeptical about. And also these things that we see that result in isolation, so refusal of help, refusal to allow people to come in and into your life, those increase your likelihood of being abused. So who's the perpetrators? The number one perpetrators of elder abuse is the adult child, and that's for all forms of abuse, including sexual abuse, followed second by spouses. Just because we get older doesn't mean that our relationships, our interpersonal relationships, become perfect, right? Domestic violence often carries on into older adult life. It just morphs and changes its form, but it doesn't go away. So, and then after children and spouses, we have other family members. Other family members. So other people that you may be close to, brothers, sisters, aunts, uncles, grandchildren are in there, other family members, then followed by caregivers. Paid caregivers are actually some of the least likely people statistically to abuse people in the domestic setting. So people who live out in the community are much more likely to be abused by their loved ones. And we know this because it's just like every other type of interpersonal violence that we see. You're much more likely to be harmed or killed by somebody that loves you. And the same is true for elders. Now, when you go into the long-term care setting, the instances of, that flips a little bit. It's your paid caregivers then who are most likely to be the perpetrators of violence against you. And the way that that looks statistically is that it's our unlicensed individuals. The majority of abuse, especially abuse that gets convicted, is our unlicensed caregivers. It's our CNAs and other folks. And about 12% of the people in long-term care settings who actually get convicted of abuse are your licensed individuals. Okay, those of us who are RNs and LPNs, your licensed folks. So we're still in there, but we're in the minority of those statistics. The least likely individuals to harm older adults are strangers. Okay, and that's true of all crime that we see, even though it doesn't seem like that from the news. We're all very fearful, right, of stranger crime. Statistically, you're much more likely to be killed or harmed by somebody that knows you or that loves you. And the same is true for our elders. What we do know, when elders are harmed by strangers, they're much more likely to have long-term consequences, including death, from that criminal interaction. So here's something I want you to keep in mind, because here's where the rubber meets the road for nurses. When you come to assess older adults, it's very important for you to assess who's in their life, who's providing care for them, who's getting them to their appointments, who's helping them manage their finances. Because we have very good information about some of the characteristics of people who are likely to abuse older people, with substance abuse and mental health disorders topping the list. So if you've got somebody coming into your clinic and they tell you that they've got an adult son that lives in their basement who's an alcoholic and unemployed, you need to be very concerned for that individual. That is a situation ripe for elder abuse. The other thing that I've learned in dealing with individuals in the community is the significance of mental health disease. If you have an older couple that comes in and says, we've got an adult son, and you're doing your family history, and they said, yeah, he's 35, he has bipolar disease, we're not able to get him to take his medications, that's something that you need to be concerned about. In my recent research in the Denver metro area, all of the individuals, 17%, so 17% of the 30 individuals that I spoke with were abused. 17% of 30 people, so 5. Out of 30 people, 5 of the older adults that I spoke with admitted to being abused. And out of those, 4 of those implicated children with mental health or substance problems. So when we take our histories as nurses, it is extremely important that you know who the support system is for your older adults and what may be unique about their circumstances. Find out from your older individuals. How are their kids? What do their kids do? How are their kids living? How do they interface with their children? What kind of problems might their children have that present an increased risk for them being abused? And if they say substance or mental health, you need to be keeping an eye out for that individual. Other things that we may see, and this is one we don't think of, dependency on the elder. So we usually think about the other way, right? If the older adult is dependent on somebody, we think, well, yeah, that makes sense. That increases their risk for abuse. But if you've got the adult male alcoholic son that lives in the basement of the older adult, guess what? They're dependent on that older adult. And that drastically increases the likelihood of that older adult being abused. So if that older adult that's coming in to see you in whatever setting you're in, describes some sort of dependency of another person on them, That increases the likelihood that they may be abused. And certainly issues of criminality. In the individuals that have been prosecuted and in the individuals I've looked at in my individual research, individuals who have had assaults or other altercations or who have criminal records, they're much more likely to abuse elders as well. But it usually comes with substance abuse and mental health problems. Those things usually come together. So here's something that may be interesting to you. Up until recently, you have been an urged reporter of elder abuse in the state of Colorado. Colorado is one of only 4 states in the United States that did not have mandatory reporting laws for elder abuse. Physicians, nurses, law enforcement, we were considered urged reporters. And we've had many attempts to try to get Senate bills passed. But this year, Senate Bill 13-111 went forward. Senator Evie Hudak was one of the leaders of that bill. That bill did pass. So as of July 2014, you are now mandatory reporters of elder abuse, as are physicians, law enforcement, clergy, and the whole long list in the statute of professionals that may interface with older adults. So that means that if you suspect physical, sexual abuse, exploitation, caregiver neglect, any of those things, you have 24 hours to make a report. That's your requirement, and that report should be made to Adult Protective Services for the county that you're in, and that's new. At-risk adult.
I have a question.
Sure.
Is that for EMS too?
Yeah, EMS is in that too.
Okay.
Yeah, if you pull up that list of professionals, EMS is in there as well. Fire is in there. So anybody that interacts with vulnerable adults is now a mandatory reporter for the first time in the state of Colorado. In long-term care, we know that there are some things that are unique to that setting that lead to elder abuse, and that includes staffing problems, competency problems, turnover rates, burnout, and lack of staff training. Those are all things that continue to be issues related to abuse in those environments. For prevention, there's some fabulous material coming out of the United Kingdom about this idea of safeguarding. And safeguarding is really that anybody who is potentially vulnerable, young or old, needs to be safeguarded by those of us who are professionals. And this includes empowering them to have the ability to make choices in their care, empowering them to be able to speak freely about what's happening in their lives and to tell us when they're being harmed, and to report that and take action, reasonable action, when we discover that somebody's being harmed. Guardianship is a concept that comes out of criminal literature, and that has to do with routine activity theory, which is reducing the opportunities for perpetrators to commit crimes against older adults. And this has a lot to do with things like installing cameras, closed-circuit TV, all of those things that we do to keep an eye on vulnerable individuals, making sure that we're guarding them. So as nurses in your setting, if you're in ambulatory care, if you're in long-term care, operating from the center of guardianship, that I'm watching you. I'm watching your family members, I'm watching you. I know potentially who could abuse you, who could be a perpetrator of elder abuse, and I'm watching you. Because I'm a guardian of people who are potentially vulnerable. And then developing competencies, and this really relates to those of us within long-term care, making sure that our folks in the long-term care setting, especially our least educated and most vulnerable providers of care, our CNAs and our aides, have the training that they need, that they have the staffing levels that they need, and that they have the resources and comfort to report abuse when they see it. So for us as registered nurses, my challenge to you today after this information is to make sure that you recognize that pretty much anybody can be a perpetrator of elder abuse, particularly adult children, to report it because you are now mandatory reporters in the state of Colorado, and also because ethically we have an obligation to protect individuals, and to create, in whatever setting you may work in, a culture of guardianship, safeguarding, and competency as it relates to preventing elder abuse. Thank you guys very much for your time.